Everyday staples like rice and grains can carry cadmium, a metal that accumulates in kidneys and bones for years. Children take in more for their size and are hit hardest. Research shows measurable effects on growth, cognition, and even puberty timing. My name is Maria Kippler. I'm a senior lecturer in metal toxicology at the Institute of Environmental Medicine at Karolinska Institutet in Sweden. Since the start of my scientific career about 20 years ago, I have been studying early life exposure to cadmium and its effect on fetal and child development, as well as later life health. Cadmium is a naturally occurring toxic metal found in the Earth's crust, but most of the cadmium exposure we face today comes from human activities. Emissions from industries and extensive use of certain fertilizer are some of the major sources of cadmium pollution. Cadmium, which was initially discovered as a byproduct of zinc mining, is valued for its resistance to corrosion and is widely used in industrial processes, including smelting and refining, and in the manufacturing of nickel-cadmium batteries, pigments, plastics, and metal coatings, including those used for inexpensive jewelry. Once released into the environment, cadmium can contaminate soil, water, and air, making its way into the food chain, especially plant-based foods, which absorb cadmium from soil. Elevated levels of cadmium are also found in tobacco smoke. Children are particularly vulnerable to cadmium for several reasons. They consume more food per body weight than adults. They have developing organs and systems that are more sensitive to toxic metals. They engage in hand-to-mouth behaviors, increasing the exposure via contaminated toys, jewelry, or soil. Once cadmium enters the body, it stays for decades. Humans have no effective mechanism for eliminating cadmium once it is stored in the body. Thus, cadmium accumulates in the kidneys and in bones over many years. The European Food Safety Authority estimates that children, especially infants and toddlers, have a twofold higher relative cadmium intake from food compared to adults. Individuals with iron deficiency, pregnant women, newborn infants, and young children may have a higher uptake of cadmium than the general population. Many crops absorb cadmium from soil. Common staples like rice, grains, root vegetables, and cocoa can carry this toxic metal. Even shellfish and organ meats, such as kidney and liver, contain elevated levels. Processed baby food and infant formula foods containing rice and other grains with elevated levels of cadmium are particularly of concern for children. Their growing bodies take up cadmium more readily, especially if they are iron deficient or malnourished. In many regions, especially low and middle income countries, children are exposed through food, contaminated environments, or hazardous e-waste sites where cadmium-containing materials are dumped or burned. Additional exposure also occurs through secondhand smoke. It can cause developmental delays, lower IQ, premature birth, reduced birth weight, fragile bones, and kidney damage from long-term low-level exposure. For many years, I have been working together with colleagues in Bangladesh, studying cadmium exposure early in life and its impact on child development. We started following pregnant mothers and have thereafter continued to follow their children throughout their developmental stages. We have found that in the study region called Matlav, most cadmium exposure came through the rice-based diet. We found that exposure to cadmium is linked to stunted growth in children. The study found that at ages 5 and 10, children with higher cadmium exposure were shorter and weighed less. What's critical is that the exposure a child experienced during childhood had a stronger negative impact than their exposure in the womb. we found that cadmium also altered key biomarkers related to bone health, suggesting it may directly interfere with how children's skeleton develops. We have found that the pregnant women's cadmium exposure and the children's own exposure was associated with lower IQ score at the age of 5 years. Long-term cadmium exposure was associated with significant developmental delays in young girls, especially by postponing the onset of puberty. Children with more elevated cadmium often tend to have less educated parents, lower socioeconomic status, and higher urinary levels of lead and arsenic, demonstrating that environmental and social risks often come together. Notably, many of our findings have later been replicated in studies conducted in high-income settings with even lower exposure levels. These adverse effects on child development are problematic, as we know that altered growth patterns, as well as timing of puberty, are risk factors of developing different chronic diseases later in life. Sweden is making significant strides in reducing public exposure to the heavy metal cadmium. Through targeted policies aimed at decreasing atmospheric pollution and limiting cadmium in fertilizers, the country successfully lowered the amount of new cadmium entering its farmlands. This initial success is a testament to what focused environmental action can achieve. However, this progress has plateaued. A new generation of cross-disciplinary efforts is now essential to tackle the residual cadmium and continuing driving exposure levels down. Governments and regulators can enforce strict regulations on emissions from smelters, factories, and waste incinerators. Limit cadmium in fertilizers, especially phosphate-based ones. Ban cadmium in children's jewelry and toys, as done in countries like Canada. Strengthen tobacco control laws to reduce cadmium exposure from secondhand smoke. Public health and agricultural initiatives can promote low cadmium crop varieties and soil management practices to reduce uptake by plants. Monitor cadmium levels in baby food, high-risk crops, and water. Educate families and communities about cadmium risks, especially around food safety and household items. Industry can phase out cadmium from plastics, pigments, and children's products. Improve waste management, particularly for e-waste that contains cadmium-based batteries and components. We know where cadmium hides and how to reduce it. Let's act for every child.